Hello and welcome to from Accountable Health, a population health consulting firm. Here we explore healthcare and the various ahs. The light bulb moment. I get it. The less impressed. Sure, that makes sense. And the dagger-like questioning. What? Are you sure? Seriously? So what will your be? Today, I'm going to introduce you to the Population Health Cycle. You'll notice that cycle is spelled with an S because, as you'll see, every step of this population health program development tool begins with the letter S. The thinking that went into this has been developed over 30 plus years in healthcare. After running hospitals, both med-surg and psychiatric substance abuse facilities, and an HMO in the mid-90s, I founded a chronic care management company in 1997 called Specialty Disease Management Services, or SDM. This company went on to provide chronic care management for 10 chronic diseases or conditions in 11 states. The majority of our clients were in Medicaid, although we also served some employer groups. SDM was merged into a company developing employee health improvement programs based on the science of preventive medicine. There, I served as the president. The model we developed at SDM was a community-based model with registered nurses and what we called community resource coordinators. Today, these community resource coordinators are known as community health workers, or CHWs. Our staff worked out in the community, visiting clinics and other healthcare facilities, patient homes, and community organizations. We also provided 24 by 7 telephonic support, and we even did remote in-home patient monitoring for heart failure and COPD in the early 2000s for a state Medicaid program. So let's take a look at this framework, discuss how you might use it, and finally, we'll finish this episode with a discussion of the first step. The steps in the population health cycle are select, survey, segment, sell, solve, score, stop, start, same, and then start again or cycle. It's a continuous improvement loop. By using the population health cycle, you and your team can develop a population health or disease management program. By following each of the steps, you will create the necessary functionality and components of the program. While the steps themselves may seem simple, as always, the devil is in the details. So let's begin with step one, select. Most often, when considering a population health program, one thinks of selecting a broad and diverse population. Perhaps it's a community, it might be a health plan, a health system, or an employer, and all of the members, patients, or employees and dependents in that system. But one can also look at a population health program as a subset given the population you have. For example, it could be all the patients in a primary care practice, or perhaps those with a specific chronic disease or condition, such as diabetes, CHF, COPD, HIV/AIDS, maternity, or those undergoing a knee or hip replacement. Any of these and many others, individually or in combination, could be selected as the population to begin with. Who is selected is fairly straightforward when looking at a community health plan, employer, or all of those in the primary care practice. In situations where you are selecting a specific chronic disease or condition, or perhaps surgery, one has to have appropriate selection criteria. Maybe one is using ICD-10 or DSM-5 diagnosis codes, perhaps two or more instances of the code within a prior year to validate the diagnosis. One may also add NDC pharmacy codes, secondary ICD-10 codes, CPT codes, or costs to further identify individuals for selection. Another selection method is to allow for direct physician or other clinician referral or self-referral. This is important in cases like maternity, where getting individuals enrolled early is critical, and the diagnosis codes may take a while to get to the organization through the claim system. When one is considering which codes to use to select individuals, one might also create criteria for exclusions. For example, there may be certain high cost or high risk comorbidities that one might choose to exclude from the population. It's also at this point important to consider whether you are going to use overall medical claims as one of your measures or just those claims associated with the condition when measuring your results and outcomes. In our programs, we tended to look at overall claims and tried to work with all conditions that the individual may have had, although, for example, things like automobile accidents or other types of trauma might be excluded. while others would keep these in, maintaining that they occur at a similar rate year over year. At the select stage, it's also important to consider and select the measurements you are likely to use as outcomes, including both process and outcome measures. A limitation we often see is the selection of many process measures and few true outcome measures. A quick example from the past was the selection of how many hemoglobin A1C tests were done for persons with diabetes in a year, but not the actual value of these tests. Sure, they got the recommended lab test, but did they get any better? So that's a very simple introduction to the population health cycle and step one, select. If you'd like to learn more, have a population health or disease management program you'd like to improve upon, are looking to develop a program, or would like a speaker for your event or conference, please reach out to us at info@accountablehealthllc.com and let us know your or other thoughts in the comment below. In the next video, we'll get into the segment step of the population health cycle.